That said, and we were looking at the policy in terms of how they have either budget or how they have mentioned that, because we were looking at the systems level. Number two, I want to add to what Moses has said in terms of budget allocation, whether they were affected by the supplementary. Of course, supplementary was cited during dissemination now, because after we collected data, we went to all the 7 counties disseminating the findings for them to validate and help us get reasons why we are seeing budget is allocated, but not all of it is utilized. One of the things that we discovered, when you look at budget allocation, it is not a must that all that was budgeted for will be funded. Sometimes they get less funding, not exactly what they budgeted. So when you are looking at what was budgeted against what was utilized, then you might be giving a wrong impression. But again, as I said earlier, we were looking at the publicly available documents that we utilized. Supplementary also, of course, was cited as another reason, because if funds are delivered late, it means there are activities that were assigned earlier which were not utilized, and because the financial year is coming to an end, the reasons we were given is that sometimes that money can be reallocated. So that also is another reason that was coming out when we were disseminating. In terms of what Dr. Robert asked about the methodology, in terms of how did we define budget lines. For example, in education, the 2 devolved functions, that is pre-primary and vocational and technical training, their budget lines, when you go to the documents, they are clear. Okay, I understand practically, in some of your departments of education, things are lumped like, some they have gender, others they have what, but for us, we were specifically looking for budget lines. If we were looking at budget line allocation against the department, then we were looking at the budget that has been allocated for pre-primary education and vocational training, not the whole budget that goes to that department. And then in expenditure, we look at that budget of pre-primary education, how was it expended? That is an example for education. I hope I'm answering your question, Robert. For where we had challenges is social welfare. Social welfare, unlike education, is not a budget line that you can just go and find this is for social welfare. We were looking for budgets that goes to programs that can support children. In some counties, we could go like, for example, cash transfers. Some counties had child welfare, budget lines speaking to child welfare. Those are the budget lines we were looking. So there was no consistency, especially in social welfare. For primary health care, as I mentioned, it is huge. So we went for preventive and promotive budget lines. So that is what we think Moses has answered. Prof. Onywere, he is asking the role of government, NGOs, and private sector on child matters. Again, that takes us to our main purpose of going to the field, looking at the systems level. We didn't go to the nitty-gritties of what private sector is doing. We were looking at what mechanisms have been put in place in terms of engaging or having coordination meetings between the different actors and sectors. Thank you. I hope I've answered the questions.
Yes, you have. 1 minute, Dr.
For
Benta.
me? Okay. Yeah. Thank you, Prof. Thank you, Moses and Fred, for your responses. Colleagues, looking at the insights when they are consolidated at regional level and in response to the whole array of questions, there's great opportunity. This study was informed by tools from varying parties and previous research. Prof, we borrowed heavily from the rubrics of a study that was done by APHRC, and we built on it. We built also on the institutional knowledge of the ECD network. What am I saying? That this study being a systems level diagnostic and progressing into a baseline and progressing into the next wave of data collection and analysis presents a great opportunity for us here. So I would like to urge us, as we interrogate the data which is available through the ECD network, to also engage at our levels. What are you as an implementing partner able to gather information more about? The tools are available and can be customized to any level. You're talking about definition of indicators. You can customize additional perspectives. If you're in psychosocial support for children, if you're in food and nutrition, you can customize so that you're able to move it from the policy and systems level to the implementation level. And that's my call to all of us. We need more data. We need more data for budget tracking. We need more data for spending. We need more data for even the dissemination of policy to county level. There's a space for all of us to use this data at our various levels. Thank you.
Thank you. I can see some more questions are coming, but because of time, I would request we don't answer them because we are 1 hour, almost 1 hour ahead. We were supposed to be done by 9:30, so allow us to stop there. And I would request we appreciate again our presenters. As I welcome Sally for the next session.
Asante sana. Makofi kwa Madam Agnes. It is not easy when she has to do the tough job of maintaining that we have the knowledge and maintaining time, and we have walimu wetu ambao wamependa kuongea sana, si ndio? Now, if you look at the program and the time, there's a beautiful lady in yellow walking out. I will give a signal for when we follow her. But this is what I'd like to guide us on kwanza. Najua we are now at the juncture where we were supposed to have our parallel session 1. And first, I'd like to introduce to you, for those ones who will be in breakout room 1 at Swara, there will be Dickens Omedo for you. He'll be your session chair. Dickens, wherever you are, musimame ndo mumuone. There's a gentleman at the back. Mumemwona? That is for breakout room 1. Wale wote ambao watenda Swara, that is the gentleman you follow for any support you require. Then we have breakout room 2, Kifaru, by Dr. Abdikadir Adan. That is our chair. Dr. Abdikadir? Here he is. Mumemwona? Watu ambao watamfuata ni wenye wanaenda Kifaru. Tafadhali, this is your session chair. And finally, room 3, which is Nyati, Dr. Elizabeth Kithuka. Daktari? Session chair? Yes, at the back. Do we all see her? This is the guidance, and I stand guided. Najua tunasikia njaa, and I would like first to give us about 20 minutes. We take some tea, and then we diligently walk to our room. Sindio? Before I cue her in, there is an amazing exhibition that has been set. After the restaurant, you walk down the path straight ahead. Partners came together and put for you to be able to talk to them more, mingle with them more, ask them more, seek for partnerships, seek for funding na hizo vitu zote, si ndio? Mkitaka UNICEF wako na booth kule, ICS wako na booth kule, Moran Publishers, watu ambao wanataka literacy ya watoto, kuna vitabu kule. Kuna wengi sana. The county government of Garissa has its booth as well. We have Kidogo Early Years, we have PATH, we have Aga Khan Foundation, we have Save the Children, we have very many partners. Even us, ECD Network has a table. So kindly, as you mingle, as you look for these panelists to continue talking, visit the booths, keep visiting them during breaks. So, Barbara, this is your cue to let the kitchen know we are ready for a small 20-minute tea break. And the team help us be able to support our session chairs. Ndio watu wasipotee na watu wasichelewe. Na joto tutakuwa na mikutano, si ndio? So we can leave according to rows. We come back here after we have parallel session 1, which was ideally supposed to run till 10:30, and we are short on time. Then we would have parallel session 2, which was supposed to be 11:10 to 11:55, Kifaru and Swara. So what we will do is this. I will come to the breakout rooms to guide each and every one of you and chief whip you back here according to the program. So you will see me in your rooms. So let's diligently walk out pole pole. There are 2 serving portions, serving spaces. So help me be able to have the delegates stand guided on how they should stand. The middle row, you can now stand. Slowly as you go downstairs for tea. We will chief whip you back to your rooms and then we will give you further communication. Row 3, you can also stand pole pole too. Pole pole.
Swara is this one. This is the room 1. Huh?
For the ones in the program that had breakout room 4, Nyati is what is going to host you. Nyati will be for the ones, if you in your program you are supposed to be in breakout room 4, for you it is Nyati. Nyati is where you will be. But we are with you, we will be able to guide you.
Request to have the following panelists: James Onditi, Pamela Josephine, Dr. Eunice Njeri, and Brenda Otieno. Please confirm if you're around. James Onditi. Pamela Josephine. Yes, Pamela is around. If you can come in front and take a seat here. Dr. Eunice. Do we have Dr. Eunice? And colleagues sitting at the back, could I request that you maybe just move a bit in front? Do we have Dr. Eunice Njeri in the room? Do we have Brenda Otieno? If somebody knows them, can you just please give a buzz to the panelists? Yeah, thank you and welcome. This is Swara. Our topic is from vulnerable to valuable, sustaining ECD initiatives. We're just waiting for some of our panelists to come so that we can begin. And Mr. Peter, could you reach out to Brenda? Yes, please. Okay. Yeah, we have Brenda in the room, one of our panelists. Mr. James Onditi, are you somewhere? Anyone from KU, if you can reach out? Okay. And Dr. Eunice? Yes, please. So Pamela, please take the seat in front here for the panelist. Brenda, welcome to the panelist seat. Okay, thank you so much. Because we have this panel running for 40 minutes, I want to take this opportunity to introduce the first two panelists. And I'm going to start with Pamela Josephine Anyango. If you can just wave to the audience. Yes, that is Pamela Josephine Onyango. Pamela is a county government employee from Siaya County, and Pamela coordinates reproductive health services and nurturing care for early childhood development. She's actually the county focal person for ECD within the health department. And I know her experience spans for more than 2 decades with the health department at the county level. And she's also a member of the multi-sectoral coordination team within the county. Pamela has interest in research, and especially in utilizing human-centered design to inform and co-create sustainable projects. And then I have, to my immediate right, is Brenda Otieno. Please wave to the audience. Yes, Brenda Otieno works for KMET. It used to be called Kisumu Medical and Education Trust, but it rebranded to KMET. So KMET is based in Kisumu, is a non-governmental organization. Thank you. Yeah, so Brenda works for KMET, and Brenda is a researcher. Has been conducting research and leading also in the issues of data management at KMET. And much of our work has been on health research, policy, and advocacy. She is an accomplished publisher with almost over 20 publications that can be referenced in peer-reviewed journals. And also, she's currently pursuing her public health doctorate, and she will share with us today. I also have the pleasure to welcome my third panelist, Mr. James Onditi. Please wave to the delegates. And James Onditi brings in the unique experience in terms of finance and administration, having been in this field for close to 2 decades now. Yes, and currently you serve as the administration manager for finance and admin manager at the Kenyatta University Women Economic Empowerment Hub, KUE. And he's done a lot of work. Previously, he worked for Kenya Industrial Estates and Equity Bank, wenye pesa. Sawa sawa. So we welcome you, and we're looking forward to hearing your experience. I have my other panelist, my 4th panelist, Dr. Eunice Njeri. If you are around, please come in front. Okay, thank you. As you come in front, can you wave to the delegates? Yes, that is our Daktari Mvungu. And just to share a bit for Daktari is that she is a lecturer at Kenyatta University, the Department of Counseling Psychology. And Dr. Mvungu holds a PhD and also a master's in counseling psychology, both from the Kenyatta University. She has done a lot of research work, and she has a lot of publication in research. She's also a member of several professional bodies, both in the academia and in research. And this is basically in Kenya and within the globe. And today we will also be listening to some of the good work that she has done while at KU. So a round of applause to my very strong panelists. I'm not feeling the claps, please. Yes, thank you so much. And my panelists feel most welcome. It is just gonna be an easy discussion. We have close to about 40 minutes. And that means that we have to really manage our time. And for our audience, I want to request that we have a few housekeeping points. And to our panelists also, a few housekeeping points that manage the time. Please be more direct in terms of articulating your issues. And for the audience, please ask direct questions. And I want to request that all of us have a piece of paper, right? Yes, so as they present, please make sure that you use your piece of paper to jot down your question. And I have my support team here who will pick the questions and I will read them on your behalf. If time allows, then I will allow the audience to ask a few questions, just for us to try and manage the time that we have here effectively, because we only have like 40 minutes. So thank you so much for trying to abide by that. And I'm going to have Brenda Otieno, who is going to share with us. Just sit. Yeah, just sit. So Brenda Otieno is going to share with us on a topic called Caring After Birth, exploring the realities of postnatal care for mothers and infants in Nyakach, Kisumu County. So you're not going to have a presentation, but I will ask you a question, and allow me to move to this side and now ask you your first question. So we will have the round of first questions and then the round of second questions. So considering your topic, Brenda, and having undertaken this study, could you share why postnatal care is critical for the survival and well-being of both the mother and the newborns, especially in the rural setups that you did this research?
Thank you very much, and thank you, teams, for being here today to listen to our papers. I think for us, we would want to reiterate the importance of the postnatal care phase during care, because one of the key issues that is rising up currently is that there's a lot of evidence that suggests that most of our mortalities, both for the mother and the child, occur during the postpartum phase, and is most especially within the 7 days after delivery. So this particular phase is very important for us, or to us, because we are looking at issues risk mitigation. If you're going to catch these risks early enough, then we need to really put in a lot of investment in looking at our mothers and our children's health after delivery. Then we're also looking at catching up or managing some of the complications. For those of us in maternal health, we also know that currently we have the highest number of maternal mortalities in our country. And also when we look at the neonatal mortality rate is very high and beyond even what is recommended us with the SDGs. So for us to also catch these complications early and of course manage them, we need to really focus on this particular phase. We're also looking at issues concerning the support that we give our mothers. And we will agree as the choir for the ECD. We always say that the mother's health, mental health, is very important for our child. So if we have a woman that is not mentally well, then again we cannot assure that the child that has been born will be mentally well or will have improved health. So again, we want to ensure that we are giving our mothers and our children that comprehensive support. And this is the phase whereby we encourage comprehensive breastfeeding, exclusive breastfeeding, sorry. We are looking at issues nutrition, both for the mother and the child. We are looking at issues mental health, which is currently on the high. And also, we are currently seeing a lot of incidences of the postpartum depression. So this is the time that we want to catch that and, of course, ensure that this particular negative impact on health is not being passed down to our children. Then again, we know, as the national government, we know our guideline on our care after birth, of course. So it's part also of the continuum of care, where we are looking at the whole health of our mothers and our children. Thank you.
Yeah, thank you so much, Brenda, for bringing those particular insights in terms of this topic, and good to see the insights in terms of risk, management of complications, supporting the mental well-being of the mother as some of the key things that we are looking at. And so I want to transition to Pamela. And while you are holding that thought, Brenda, I will come to you with another question, but let me transition to Pamela. And Pamela has a topic on co-creating solutions for maternal and child health, basically looking at the role of healthcare providers and healthcare promoters in human-centered design. And so, Pamela, could you just highlight to us, human-centered design is a problem-solving approach and prioritizes the people, basically putting the people at the center. And so, could you share how you have used this approach to improve healthcare providers' capacity to integrate nurturing care for early childhood development? Thank you.
Thank you. Good morning to everyone. So for the creating for the solutions and the human-centered design, we were implementing nurturing care for quite a number of years, but now there was a mislink somewhere, and we felt that it was important for us to bridge this gap. So in this, the practice bit, as much as the caregivers were coming to us in the facility, maybe we could have some sessions within the facility, but what was happening back at home, there was still the practices now. So as a result of that, as a team, we came up with the human-centered design to come up with
The mic, team, please.
Sorry for that. So we came up with a solution to bridge this gap. And in that solution, number one, the caregiver was now put at the center, the person who really implements. Because if it is at the facility, maybe the mother or the caregiver will be there, or the male partner will be there, maybe for at most 1 hour or so. What happens to this child the remaining hours? So in this, we started by trying to understand, to empathize, what is this that is happening in the community? So through empathizing or discovering what was happening in the community, we discovered that there was a gap when it came to now the responsive care to these young children. So after empathizing and trying to discover, we got into a process of co-creation. And in the co-creation process, we held the community health promoters, we had the caregivers, and we also had the healthcare providers trying to co-create what can we do best with these different players. And on doing this, we now moved to prototyping. And in the prototype, we developed with the 3 players and the other stakeholders also, we developed what was now trying to bridge this gap. And in the end run, we discovered that indeed the gap was bridged. So after developing the prototype through the testing of the solutions, we dealt with now capacity building. There was a gap. Because in this gap, the gap that we discovered that was there, as much as we were giving some information, some dosage to the caregivers, but it was not the same across. And through the capacity building, the healthcare providers' capacity building was done. The community health promoters' capacity building was done. Then to the caregivers, capacity building was also done at the household level. Other than the facility, it was done at the household level because in SIA we have 100% household coverage. So after the capacity building, we now started implementing these in 2 facilities. We had 2 facilities with the implementation, then we had 2 facilities that were acting as our control sites. And interestingly, there was an increase in the indicators that we were looking at. And this showed us that human-centered design, in everything that we plan to do in the space of nurturing care, can we involve the people that are mostly there for us to get the correct solutions to the problems. Thank you.
Thank you so much, Pamela. Key thing coming out there is co-creating with the user, coming up with a prototype, testing that prototype, iterating, and then finally landing the solution. Thank you so much. While we pause at that, we'll come to your learnings, but I want to transition to my colleague and from the finance perspective, and I know you had a paper, and your the main focus was basically looking at the effect of enrolling 3-year-old children to pre-primary on women economic empowerment. This is evidence from a randomized controlled trial study in Tharaka Nithi County. Anyone from Tharaka Nithi County in the room? Yeah. Okay. Sawa. Your study is here. Thank you, Mr. Onditi. And from this study, basically, I would like you to share with us on how you think women who have access to childcare services are more likely to engage in paid-up work and other entrepreneurial ventures, thereby contributing to higher household income within their settings.
Thank you. Thank you very much for this opportunity. It will be best if I give a background so that we can connect with the question. The Kenyatta University Women's Economic Empowerment Hub is conducting a randomized controlled trial study in Tharaka Nithi County, basically having a treatment group and a control group. The treatment group comprises of 58 schools enrolled and 60 schools under the control group. Now, we are pursuing 2 outcomes. We are pursuing an outcome on child development, and we are pursuing a second outcome on women's economic empowerment. So my colleague, Dr. Eunice, will be speaking to the outcomes around child's development, while I'll be speaking to the outcomes around women's economic empowerment. Now, we have a very interesting, innovation in terms of a curriculum, which we are using as the intervention. It is a modified curriculum. It has been assessed by KSCD, and this curriculum is a play-based curriculum. It has mentors and caregivers who are delivering this to the target group, the children. But then these children come from homes where they are mothers and parents. Now the study, or what I'm about to present today, is trying to see if there's any nexus between having these children enroll in school and women's economic empowerment, entrepreneurship, and other income generating activities that they engaged in. We all know from literature that the burden of unpaid care work, and particularly child care burden, is a constraint to women's participation in labor market. We all know this. So this is what we are trying to bridge the gap in. In Africa, there are not many studies that have assessed this particular issue, between the nexus between enrolling a child in a care center, in this case 3-year-olds in the ECD programs, and the women's economic empowerment. So it's an interesting study. The preliminary findings, of course, this is based on baseline data that we collected. The preliminarily, we are seeing very interesting outcomes, especially in women's economic empowerment. One of the interesting things that we are seeing is that a woman's age is quite critical in her engagement in economic activities. There are the active working years that women, and these are unfortunately or fortunately, these are also the childbearing years. The active working years are also the childbearing years. So there's a clear nexus that for a woman to actually be engaged in economic activities and at the same time take care of the children, there's an opportunity cost. So what we are seeing is that relieving mothers the burden of childcare and taking these children to a center where they are learning, they are engaged, and the children, the mothers know that the children are safe there, is helping them to work effectively and participate effectively in labor market. I'll share a bit of the findings later, but for now, I just want to give you those forward understanding and background of this study. Thank you.
Okay, thank you. Thank you so much for bringing that particular background. And yes, indeed, this is a very critical topic. And I know it resonates with all of us. Sindio? Yes. Hata wewe ukiambiwa saa zile house manager amepotea asubuhi, umetoroka job, sindio? On a light note. Thank you. And transitioning to Daktari Mvungu here. And please share with us a bit more on this topic on the status of self-regulation skills among 3 to 4-year-old children in Tharaka Nithi. Basically, this is from the baseline assessment that you conducted. Yeah, if you could, a bit more of the background and some of the key learnings here. Thank you.
Okay, thank you, Chair of the panel. Good morning, everyone. So like you've heard, my name is Dr. Eunice. And yes, reading a little bit on the general introduction given by my colleague here, I will just want to add that the baseline assessment in the Tharaka Nithi County focused on, among other things, evaluating self-regulation among the 3-year-old children. Now, to put us into perspective, it is important we understand what we mean by self-regulation. So when we talk of self-regulation, we are referring to a child's ability to focus on attention, manage emotions, control impulses, and behave in a socially appropriate manner. Now, self-regulation skills comprises 3 core components, one of which is attention regulation. When you talk of attention regulation, we are referring to the ability of a child to focus to a given task or to tasks. And the second component is behavioral regulation, and this has to do, for example, with rule following or taking instructions given. And finally, is socio-emotional regulation, which is about how a child manages their emotions. Say, for example, in a scenario whereby a child grabs a toy from another child. So the victim, in quotes, you look at how does she or he react? How does she manage the anger that she finds herself in after the toy has been grabbed? Now, research done globally has indicated that deficit in these self-regulation skills, especially among the preschool years, is linked with poor academic performance, social challenges, and socio-emotional issues later in life. Now, to precisely respond to the question asked, I want to say that self-regulation is essential for children's success in the early learning, and this is because it equips them with the ability to focus on tasks given. You know, like in a formal school learning, in a formal classroom environment, there are tasks to be given. So, does the child has the ability to focus on the tasks probably given by the teacher? Then, is this child able to follow rules given, say instructions? And finally, are they able to manage their emotions as they interact with their peers and the adults, say like teachers? And this, is, of course, is very essential for navigating a formal classroom environment. So I hope with that I've been able to respond to your question.
Thank you so much, Daktari, for bringing those background and the perspective in terms of making us to try understand more about the regulations and what that means. Thank you. I will pause at that point, and I'll come back to you with, to share some of the key learnings. But I know a few colleagues joined in when we had started. We had a few issues of housekeeping. We said that if you have a question, please jot them down in a paper, and I will have someone collect them, and then I will read them. So just indicate your name and your question. And as I want to transition to the second round of asking my panelists some questions, I just want to take a moment and recognize the First Lady of Bungoma County, Dr. Margaret Makelo Lusaka, who is in the room with us here, listening and learning. Thank you. I move on to Brenda. And your study on caring after birth, exploring realities of postnatal care for mothers and infants in Nyakach. Could you speak to us on some of the urgent issues that need to be strengthened to support postnatal care for mothers and infants?
One of the key learnings that we got from the study, which would recommend as one of the urgent things that need to be really addressed, is for implementers and even the government in itself to come up with community-based initiatives that would strongly improve education and of course also scale care outreaches within the community level. Because we did realize that during the study, when we were talking to postnatal mothers, they had a lot of challenges, and some of them leaning towards the systemic gaps. Some of them were based on terrains that they were having. Others were social cultural issues. Others were, of course, linked to even the kind of autonomy that they have as women. So out of all those findings, we did realize that one of the key issues that really, really needed to be strengthened have to be done at the community level, and not having these women probably go to the facility system. But then that linkage is also very important. But how best can we have community interventions that mostly target education and of course target scaling care at that home level where they are? To speak in details probably, I would highlight one of them is health education. And one of the things we are looking at, even as we talk about health education, we were looking at even the providers in the facility. Some of them have not been given, we can call it the in-service training, given updated knowledge on what is required when we are talking about postnatal care. Some of them have not had any sort of refreshers or any sort of even the ECD training. They do not know. So even when these mothers go back to the facility, they do not know what to tell these particular mothers. They'll be sticking to the routine kind of care. We have the cultural sensitive information. We know in our societies we come from cultures. We had women who were even told not to go to the facilities for 40 days. I don't know whether it happens in your community. But back where I come from, there are some cultures, some religions that prohibit women from going outside 40 days after delivery. So for us to even reach these particular women and ensure that they are going for those postnatal care, then we have to address such kind of cultural sensitive information. Then we have CHP empowerment, that is community health provider empowerment. Key gaps that we did realize during that time was that most of our CHPs, in as much as they are the lifeline to these particular mothers, and they are doing their work very well, I would say, but then they need a bit of empowerment because we realize they don't even have the tools. We go to these homes, but what information or what package of care are we giving our women? So probably they would just go say, hi, how is the baby, how are you, and leave. But then we feel they need more package, in terms of package or content that they are sharing with these women. Then again, we are looking at the checklist. Our supervisors, the healthcare system, the providers, the county. Do we even supervise and see, or do we have a way of even measuring or having accountability checks with these our CHPs? Whether they went to those homes, I know they have their targets and they will check their boxes, but are we having any kind of checklist to ensure that a number of services or a number of items was done, or maybe they did a couple of things? Then we're looking at also the tools. One of the key gaps that we also realized in our facilities, we realized that even the mothers do not have the mother-child booklet. So the mother cited that there was a time they were not given. We will confirm. But then that was another gap, because now without the mother-child booklet, most of them claimed they did not see the return date. So they are not going back to the facilities. They don't know. Then we are also seeing in our facilities in themselves, most of our maternities do not have the postnatal care register. So even if they have, then they are not utilizing. The other thing that was coming out also very strongly was on service integration. Our women go back to the facilities, yes, for the few that went back. But when we go back to the facilities, probably just for the immunization service. But during immunization, are we even looking at the babies? The stimulation, the other components of nurturing care? Are we having our providers checking that? Or we are basically just immunizing and moving on forward? So we realized that a lot of complications were not being picked up during the postnatal phase. So the children come to us at around the 4 or 3 years now, when they're getting into the ECD. Then you start realizing they're having those delayed milestones, they're having the autism spectrums and all that. But these should have been picked earlier during the postnatal phase and probably given the necessary care that they needed to resolve those issues. Male involvement. Again, I don't know about your communities, but for these particular communities, there was a cry. And they were talking so much that they needed the male to provide that supportive care postnatally. So we even have 2 cases. One, we were seeing a lot of the men eating chakula ya watoto na kukula chakula ya mama. So men, I don't know if it is just our community, but men, please, mama akitoka kuzaa, allow them to eat well and allow them to feed their babies. The other thing that the women were citing was also the sport pesa thing. I think it is Betika or what, the betting issues. Right now, the men go to work, they collect their monies, they take the monies to betting.
Okay.
The women were also complaining, they save a little bit for their care, you know, the birth planning and all that. The little money they save, the men pick and go for betting. So for us, I think the priority for us right now is those community-based interventions that are going to improve the education and are going to ensure that postnatal care is really, really reaching down to the community, those outreaches.
Thank you so much, Brenda. Very good points there in terms of tools, in terms of dosage, what content are we giving, integrating services, key, and then male involvement, as well as also looking at some of the cultural issues. I know we are supposed to end by the next 5 or 7 minutes, and so being cognizant of that, allow me to jump to Pamela, and please share some of the key critical learnings, if you can summarize them in a very good way that you know. Thank you.
Thank you. So few lessons that we learned from the human-centered design co-creation was: 1, integration of nurturing care into the routine services is very key. It is key because when we look at, right from yesterday, a number of us delegates were still confusing ECD to ECDE. So before we talk of this child of school-going age from 3 years, we have 0 to 3 years, the first 1,000 days. So when we look at this integration of nurturing care into the routine services, we have the bit of the different touch points areas within our facilities. 1, we have the antenatal clinics. So in the antenatal clinics, if they come as a couple, the male partner is also encouraged to talk to the baby while the baby is still in the utero. Because many people assume that the baby cannot hear before maybe certain months. So we have the antenatal clinic, we have the postnatal clinic, where the entire family is also encouraged to talk and play with this young baby. Other than the postnatal clinic, we have the normal child welfare clinic. In the child welfare clinic, so as these babies come to the facility, they should not associate the facility with a place where they'll get pain, but with an area where they can play and enjoy being in the facility. So as the caregivers come while they're waiting to be served, play items in various facilities are placed. Then as they wait, health education is taking place, then the children can continue playing. Another key area that we also learned is the development of the standard operating procedures. And in this, we used the national card, which is our MOH 216, that is used for antenatal care. And this was also part of our recommendation that other than us just to continue issuing the mother-child booklets, it's important that healthcare providers be frequently updated, because the booklet is so useful and rich in information, but it is not being used. Maybe from the level of a healthcare provider, at times due to staff shortage, there is that task shifting. You only, once maybe the biodata has been filled, you move to the page where you're going to palpate and write your findings. So the use of MOH together with the SOPs. So these SOPs were developed in line with the MOH 216. For example, like we have page 25 25 or 44, where we check for the delayed milestones. The caregiver can do this back at home. The mother should be able to know that maybe at this month the baby should be able to lift their heads. Then on the SOPs still, we have the counseling cards. Like if it is in a session, this baby between 0 to 6 months can play with these particular play items that are safe. 6 months to 1 year can play with these particular play items, then 1 year to maybe up to 2 years.
Okay, thank you, Josephine. I will have to cut you short and ask KU team to provide for us the learning, I think in summary. Yes, please.
Thank
if
you.
You can
Thank
combine
you.
both. Yeah.
Thank you very much. We constructed women's economic empowerment around Kabia's definition of women's economic empowerment, basically looking about the components of agency and decision making, access to opportunities, and also control of productive resources. And what we have seen out of the baseline data is that the effects or the relationship between enrolling 3-year-olds to school and women's economic empowerment are more visible where women are vulnerable and in low-paying jobs. What do we mean by this? The higher you go or the more income you earn, there is a likelihood that you will be able to have a caregiver, so that enrolling a child to school at 3-year-old might not make much difference. But for the low and vulnerable women in the rural areas, this is a big, big boost. And we know that majority of the women are actually in the rural areas, and they are engaged in entrepreneurial activities, they are engaged in businesses, small businesses, and so this intervention is more meaningful and most meaningful in those conditions, including in urban centers where there are slum-like conditions. So this intervention will be more meaningful in those areas because these women will greatly benefit and will have the time to participate meaningfully in the labor economy.
Thank you.
We also saw that, just one last point, we also saw that health and education are critical factors to women's engagement in economic activities. The healthier a woman is, the better or the more engaged she will be, or the likelihood that she will engage in economic activities is. And so I concur with my colleague on her finding. Of course, there's the issue of our social norms. The way we have normalized ourselves. There's an issue there. And it comes across almost all these studies. When you read literature review, you see this issue of patriarchal society. It cuts across all the issues. So maybe our next studies and our next thinking should be, what do we do with these many negative cultural practices which appears to be lowering and putting the women down, sometimes even disengaging them from economic activities. Thank you.
Thank you so much. Dr. Finally, if you can share one key learning that can be number one, and then answer the two questions in 1 minute.
Okay. Yes. One of the key findings is that we didn't find that majority of children exhibited above average self-regulation skills in all the 3 domains I mentioned, that is attention, behavioral, and socio-emotional. This means that these children, the 3-year-old, can actually be accommodated in a formal school learning. That is the key lesson I've decided to pick on. Some of the questions that I have 2 questions here. One of them is how do you equip caregivers to manage the 3 regulations, that is the 3 domains, attention, behavioral, and socio-emotional. I want to say that our standard did not delve into this. But generally what I would say that this should be food for thought, because I do not have very specific factual responses on how we can inculcate attention, behavior, regulation, and socio-emotional regulation, socio-emotional regulation. But it is important to know from psychological perspective, the environment in which a child finds themselves in, children find themselves in, starting from home to church, to school, to the neighborhood, has a lot to do with the outcome and the exposure that they get on how to, on the 3 domains. So that let me not say that I have a specific response for this because it's a very broad area.
Thank you.
The other question is, in terms of child's emotional regulation, as early as 2 years, running to 3 years plus, what strategies can you employ to make the child understand the boundaries in cases where the child uses manipulation and attention-seeking behaviors to get their way? Now, okay, I want to say that similar to what I've said, this is a very broad question, and we know we have as many parenting styles as we are. All of us do parenting in a unique way, but most importantly is the way you handle your child. The way you handle the child, the environment, the exposure you give that child will determine whether they will manipulate you or not. In fact, if they are manipulative, you need to ask yourself why. And that makes me feel like it is good to research more, read more, attend parenting related trainings so that we can learn this. So from the findings perspective, I do not have responses that I can draw from our study in Tharaka-Nithi.
Thank you so much, Daktari, and I appreciate your responses. Please, maybe you can do a follow-on one-on-one conversations with that.
Yes.
And yes.
Can I also kindly add that this paper has been done by many of us. All of us are here. We have the county government of Tharaka-Nithi, my colleagues, Dr. Gashara there, Dr. Onditi, Dr. Oteo, CEC Naivasha of county government of Tharaka. We have Professor Onywere, who is also familiar with this. So when time allows, they can come in and maybe give responses to some of these questions that I wasn't set for.
Yes.
Thank you.
Thank you so much. There's a general question here which I know my panelists are not able to answer, but anyone in the room can just take a minute to answer, especially from the education and health. Mr. Mohammed Hassan asks that we have some children who are suffering from eye problems, i.e. they are short-sighted. As for themselves, they cannot identify their problem. How are the teachers trained to identify such children and advise their parents accordingly? Yes, in 1 minute, please answer that. Just direct to the point.
Thank you. Good morning, everyone. My name is Mishi Sylvia. I'm here with Aga Khan, but I work with Save the Children as an education officer. So for children with disability, because short-sightedness it's a disability, normally as a teacher, you are just supposed to refer the teacher to the right place. That is, the learner should be taken to the EAC center for him or her to be assessed for better placement. So the teacher has nothing to do with identification and assessment of the learner. Thank you.
Thank you so much for being direct. You've identified the problem, refer to the relevant point of services and they will be assisted. I would have really loved to continue, but I will have to stop at this point because I've eaten 5 minutes of the next panel time. And I know, McKenna, you will allow 5 minutes extra for the other team through the chair. Yes. So I want to say thank you so much for my panelists for doing a good job in summarizing your studies and sharing with us. Please just mark them. If you have a question, you can just interact over break, lunch break or evening break, and you can get more insights. And also we are going to publish all these abstracts and presentations, and you will be able to also follow through that. So without much further ado, allow me to ask the panelists to stand up for a photo with me. I don't know if there is any photo somewhere. If that is delaying, then just let's, okay, yes, one photo is coming there. Obare, are you there? Co-presenter with Brenda, are you there? Please come. In 1 minute, please.
And Jacqueline, yeah, and Jacqueline. Join us.
Okay, please, let's do it faster.
Actually, we were many. Oh, they're not seen.
Okay, that is done. Thank you so much. A round of applause for the entire team. A round of applause for the session chair. Thank you so much. Thank you so much, Prof. Amenisalimia. Yes, thank you so much. So allow me to end the session and thank you so much. My name is Deacon Somedo. I am a board member for the ECD network. I work for PATH and in the early childhood development space. The second session is coming in and I would like to ask that the session chair to come and take over. There is panel 1 happening in Kifaru, led by Dr. Benta Ouko, and panel 2 is happening here at Swara, and this is going to be led by Dr. Roslyn. So please, Dr. Roslyn. McKenna, can you remind me the topic for Swara? Yes, you are the next session chair. Yes. Do we have all the delegates here now, or there are still other breakout? Okay. Thank you so much. Allow me to usher in the next chair. A round of applause to everyone. Thank you.
Okay. Good afternoon. Forgive that I'm still panting. I was presenting in another room and our room has delayed. But here I am. And we want to have our next session where we are having a panel. And I want to invite my panelists here. I think we have the seats ready. So if you are there, Lynette Kaloki. Lynette. Okay. Ambrose Orege. I know there are sessions that are still going on. Silas, Dr. Silas Onyango. Dr. Silas Onyango. Professor Simon Onyere, at least. You can sit anywhere. But I can see we only have Prof here and the rest are not here. Can I be guided? And then Jane Kariuki from UNICEF. Jane Kariuki. Nelias, we don't have panelists here. You are with her? Okay, so are you the one standing in on behalf of the group? So Lynette Kariuki is part of the, not Lynette Kaloki is part of Kevinson Mwangi, Daniel Rabok, Amina, and Anil. But it's Lynette who is presenting. I'm being guided here. They go look for them in Nyati and Kifaru. Anyone, if you have their phone numbers, you can call them. Evans Mnuve, yes, you are here. So Dr. Silas Onyango and their team, no? So as we wait for them, I think I can start saving time by introducing these ones who are here. I'll begin by introducing Professor Simon Onywere. He is an associate professor in the Department of Spatial and Environmental Planning in the School of Engineering and, what is AMP? And Architecture, Kenyatta University. And he balances both academic roles and with impactful research and community engagement. Professor is currently leading a Gates Foundation-funded study on preschool intervention on the effects of child learning and women's economic empowerment in Tharaka Nithi County. During the Jubilee anniversary of the Regional Center for Mapping of Resources for Development on 16th of June, he was recognized for his role in mentoring many young researchers in the use of spatial knowledge and technologies. In October 2020 to 2021, he was the government multi-agency technical committee that assessed the socio-economic impacts of rising water levels in the Great Rift Valley lakes, Takwel Gorge Dam and Lake Victoria. And I'll skip some of the things. He specializes in integrated environment management, developing participatory catchment management plans for communities. He led disaster risk management studies and training across East Africa, including IGAD states. Currently, he chairs KU's Global Tourism Resilience and Crisis Management Center board and actively contributes to the ECD network in Kenya. Thank you. As Silas breathes in, allow me to, let's appreciate Professor and clap for him. Thank you. Lynette Kaloki, you can raise your hand. Yes. She is an ECD specialist with over a decade of experience leading community-based programs and research across East Africa. She currently serves as an ECD technical specialist at Aga Khan University, focusing on gender-responsive childcare and system strengthening in Kenya's ASAL regions. Lynette holds a master's in child development and is passionate about advancing equitable, evidence-based solutions for children and caregivers. A round of applause for Lynette. Thank you. And then we have Dr. Silas Onyango, who has just walked in and as is panting. Dr. Onyango is an associate research scientist in the human development theme at the African, or popularly known as APHRC. He leads various research projects within ECD unit. Dr. Onyango holds a PhD in public health and epidemiology with a focus on children's developmental outcomes for the Swiss Tropical and Public Health Institute. And I'm trying to, he also has a master's science degree and a concentration in ECD for children with special needs from the Norwegian University of Science and Technology in Norway. He has a bachelor's in early childhood development and education from Kenyatta University. He's passionate about understanding how childhood experiences influence lifelong outcomes. With extensive peer-reviewed publications, Dr. Onyango family believes that all children, regardless of their cultural background, race, blah, 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 are treated with dignity and equality. He advocates for protection, promotion, and support of early development through evidence-based health educational interventions. A round of applause for Dr. Silas. Thank you. And I know we have Dr. Evans, but I don't seem to have his profile. Evans Munuve, and maybe you can give us just in one sentence. Okay.
Good afternoon. I'm Evans Munuve. I work with the Ministry of Health. For the last 35 years, I've been working with the Ministry of Health. My basic trainings are occupational therapy. I've specialized always in therapy. I have BSc in speech and language therapy. I have basic and advanced in Kenyan Sign Language. And also I've done studies in autism and the like. My specialty is in children. Currently, I'm the program manager for Early Child Development, Ministry of Health, Ramka Division. That is the position that I'm currently.
All right. Thank you very much. A round of applause for Dr. Evans Munuve. All right. So welcome to this panel. And in this panel, if you have the program, you are aware some of these presenters and what they're going to share with us. And I have a set of questions that they'll be responding to us as they share with us findings of studies they have done, and all of them touching on the different aspects of our children's life. I think from yesterday, you know, I am Dr. Roslyn Olumbe, and I head the Institute of Child Development at Daystar University. And I will start with Lynette Kaloki. And their topic of their study, of course, it's a team. We have Kevinson Mwangi, Daniel Rabok, Professor Amina Bakar, and Dr. Anil Kamis, who are, part of them are here. They can raise their hands and you see them. Yes, right there at the back. Their topic is caregivers' mental health and the strengthening of early childhood development systems, research findings from Isiolo and Lamu, Kenya on Care for All. So Lynette, we are so delighted that you are here to share with us what you found out. Your study seems to highlight an equal burden of the unpaid care for Kenya's ASALs and its association with the mental health, especially among women. Now, given these findings, what particular policy interventions or community-level strategies would you recommend to reduce this emotional toll? Maybe you can speak to that. No. I'll just say, as you speak to that, you can give us like in 1 or 2 sentences, summary of the study, and then you answer my question.
All right. Thank you so much, Dr. Olumbe. So as Dr. Olumbe has mentioned, the study is on unpaid care work, and mental health is one of the variables that we were looking at.
although it was not like the main highlight, but seeing that caregivers are really taking care of children, taking care of people who are not well, that is the elderly, the sick. So this was an aspect that really came out from our findings. And looking at it, we noticed that most of our caregivers had really high levels of depression and anxiety. And so from the findings, we were able to use the PHQ-9 and GAD-7, as well as the WHO-5, just to be able to measure the levels of mental health challenges that they were experiencing. The study being in Isiolo and Lamu, it's to support these caregivers because they're taking care of children. So our study is focusing on 0 to 6 years mainly. And so looking at the policies that we would want to be implemented, and one of it is integration of ECD systems, or rather even mental health support in the ECD systems. Because these caregivers are taking care of children, they need to be able to, get the support from where they're leaving their children at. Given that we were doing the study in these 2 counties, we realized that majority of them are not taking their children to ECD centers. Mm-hmm. And now this burden is on women, and we're not saying it's not on men as well. However, we found it was really high on the women.
So the policy recommendation, what would you say, like in one sentence?
So I would say in one sentence is that we need to be able to strengthen the community-based mental health systems so that we can be able to support these caregivers, both at the community level and also at the national and county level.
Okay, thank you. And I'll still come back to you, but at this point, allow me to move to Evans Mnuve. And Evans has already introduced himself, and he was part of a study with Petrovic and Jen Kariuki, and this is their topic, using community radio and social media platforms to reach male and female caregivers with nurturing care messages, learnings from Kenya Kuwa Kocha SBCC campaign. Now, Bwana Evans, maybe in 2 minutes, would you just give us like a summary, and 2 minutes, a summary of what was this study before I give you my very first question?
Thank you, Doc. Ours is just a summary of a campaign that has been piloted in Kenya in 6 counties. We started with developing, as in Kenya, as you know, nurturing care was adopted in 2018 after it was developed by WHO in the same year. And we have been able to push for the government ownership or leadership. And out of the documents that we have developed, you have a draft integrated ICD policy. We have advocacy strategy that is still also validated, but it is awaiting the ICD policy. We also developed SBCC strategy. And in the SBCC strategy, there is that component of Kuwa Kocha, which is a campaign targeting the caregivers, the primary caregivers being the mother, or rather the female, and the father, and then those who support them, maybe whether it's a friend, whether it's a father, grandfather, that kind of thing. So Kuwa Kocha campaign, when we did our desk review, it came up with the 4 strategic issues, which was low awareness, gender issues, limited adaptation, and reduced kingship. And majorly we were focusing on Garissa and Kisumu. But the essence of the campaign, it is adapted for each and every locality, like the counties. So that is what we did. And the campaign was now to target these our caregivers through maybe radio spots, social media, and the like. And we were looking at to reach them, mostly engaging the men. And the study, if you see the paper, actually it is visual oriented, very many pictures whereby it depicts the man assisting the lady or the female caregiver and interacting with the children. So that was the essence of the campaign, to reach and maybe uplift the male engagement.
Thank you. Thank you very much. And I think that's very good as we think about the male involvement and all that. And so from the work that you've shared with us, the data shows that messages reached a very significant number of both male and female audiences, and mainly through the social media. However, when you refer to targeted audiences, could you please clarify how you ensured that the intended recipients, particularly male and female audiences, actually listen to the radio content?
Well, as a preparation of the ground, we aim to understand each and every community, the most listened radios, and at what time male and female are likely to listen to them. And that is when now we aim to look for airtime during that time. So generally, after that, there was an external monitoring agency who was recruited after the spots were given. Because like the counties that you in, even most of them are here, they have been participating in those shows. I know they are in the rooms. So we now to know now, we want to know actually what is the percent. So it was, we used an external monitoring agency which was engaged, and their reports indicated the data that we have presented. That the number of shows that we are done, or talks we are done, the number of estimated listeners and respondents, that kind of thing. So we had that short-term monitoring report from an agency that was hired. Yeah.
Thank you. And so that's very excellent that to be able to set up a monitoring aspect to help you.
Yeah,
Thank you.
sure.
I'll come back to you. I want to move to, I think Ambrose is not here. So I'll move to Dr. Onyango right next to me. And Dr. Onyango, together with their team, they worked on a study exploring the relationship between fathers' involvement in childcare and family engagement for children with developmental disabilities in Western Kenya. Silas, as we get into this and look at your work, looks a very commendable piece of work just like the others. Would you tell us, like in 2 minutes, a summary of this work and your findings before I get to my next question? Thank you.
Thank you, Dr. Lumbe, and thank you everyone who are here. I think what we did, this was not really the main focus of our study. We were looking at integration of nurturing care for children with developmental disabilities in Siaya County in Kenya. But then in the process of our analysis, something interesting came up depending on the questions that we were asking the mothers. So we were asking the mothers about the involvement of men, because men are a big question, even now in the room, their involvement in childcare, specifically for children with developmental disabilities. So our interest was drawn when we were doing analysis in this, and we decided that let's look at involvement of fathers. These ones are now fathers, and the involvement of fathers in childcare. And involvement was defined in 2 ways. One, their engagement with the children in terms of play and so on and so forth, but also in terms of support, where we were asking about buying food, fetching water, doing all those other things in that particular area. So, and then we looked at this vis-a-vis the involvement of the family. That is children above 15 years, children above 15 years together with the mother of the house. So those ones were our outcome. And looking at the four outcomes, looking at cognitive, socio-emotional, and those other activities that they involve with the children. So it was support and engagement vis-a-vis the involvement of adults and that are 15 years and above.
Okay.
Yes.
Thank you. That's a good summary. And so when we think about and just across these studies that we are looking at, and generally in the country, one of our struggles has been the father involvement. And we say it remains an under-researched area, and especially many communities traditionally assigning the role of caregiving to women and not necessarily to men. And I think we've seen partly in Kaloki's work that actually helped us to see they were looking at the burden of caregiving being to the women. Now, this gap is mostly pronounced for children with developmental disabilities. And in one forum I've sat and it was said, when you get a child with disability, huyo ni mtoto wa mama. Or it's a child for the mother, because the mother atakufa na yeye, right? Ama ataanguka na yeye. Anyway, and so in that context, if really we see that, and you're talking about this, could you please share the quantitative findings on father involvement from your sample, disaggregated by region, because it will just help us to see the level of engagement as you saw in your study.
So our study was only in Siaya County, so then we didn't have, unless you want to do the sub-counties in Siaya, but then we didn't focus on region. But what interests us is what you are saying about involvement of fathers in childcare. There is the question of involvement of fathers in childcare, but then there is a question of involvement of fathers in caring for their children with developmental disabilities. Those are two different things, because what we learned is that most fathers, when the children are diagnosed or they realize that they have these forms of disabilities, they usually go and start the other house, and they leave these other ones. And I think that's very common. So that is why our interest was, if they are really involved in childcare, what is the role that other people in the household do? Are they also involved? And that is when we talk about our quantitative findings. We found that in terms of their involvement in play, ensuring that the play materials and all these other things in the house, the families, members of the family, especially the mother, was also involved. So it shows that there was a synergistic kind of effect. When the father is doing, the mother is doing more. And that was actually more than 23% of their involvement. And that was a very strong finding. But in terms of support, that they buy food, they come, wash clothes, they do all these other things, we found it was not as strong as their direct engagement with the children. So for this support, we found about 13% increase in the family engagement. But for their support, for their engagement, playing and doing these other things with the children with disabilities, we found that the household is quite involved with the children. And then we also analyzed data from the mix, the UNICEF mix, taking the child out, work reading with the child, doing all these other things. If the father is involved in doing these activities, then the family is involved 43%. Increase in the family involvement. So men who are in the house and men who are doing these other things, get involved in the activities with your children, because this one encourages the other part of the family members to come and contribute to the engagement with the child.
Thank you. Silas almost spoke his heart out, but thank you very much as you shared that. And before I go to my next question to you, I'd like to listen to Prof.
Yeah.
And Prof. Presenting their work on childcare provision and women's economic empowerment in Tharaka Nithi, right? And so as we look at that, I would like just to find out from your work, and maybe just in 2 minutes, if you could just summarize that study, and I get to my first question to you in 2 minutes. Thank you, Prof. Don't laugh.
2 minutes, I can't do anything. But first of all, this is the study itself involves many stakeholders who are directly involved in the project. And in here we have a fraternity from Kenyatta University and a fraternity from the county. And the first thing I want to do for you to actually see that this is a big congregation is to ask them to stand up. If you are in any one way or the other involved in the project or looking at managing it in one way or the other, I know the VC's rep is here. We can't do anything without permission from the VC. The MCAs are here. Where are the members of...
we can give them a round of applause, and then Prof, you tell us about the study. Thank you. We applaud you.
So we have a big congregation here, both from the county and from the university. The next thing I want to say is that the project itself, we are involved with the University of Yale University in the US, University of Bangor in the UK, University of West Indies in Jamaica, and our own Kenya National Bureau of Statistics. Remember, you can't do any statistics for policy making if the Kenya National Bureau is not working with you. So we are working with the Kenya National Bureau. They were supposed to be here, but I'm not sure why they didn't come. The project itself is basically sometimes in 2021, we were actually doing a livelihood survey in Tharaka-Nithi with the support of Tharaka-Nithi County. And when we met women in the field when we were doing a livelihood survey, the mothers told us that they live for the children. Their livelihood is about the children. And they also told us that the biggest challenge they have about that type of livelihood is who to take care of those children. And they also told us a problem about climate change, which is a big issue, and they told us a problem about infrastructure. And we chose at that stage that we do a policy on the 3 items of challenge, and we did a policy brief on childcare. And the policy brief on childcare was basically to find a mechanism of leveraging on an existing crèche, which the Honorable Mudhobi has graciously nurtured in Chuka, and which has actually grown into a policy now that every market that is constructed in Kenya must have what? I think only the First Lady is speaking. The rest of you don't know. Every market that is constructed in Kenya must have a crèche.
Thank you.
I haven't finished because I haven't told you.
No, because I want to ask you the question now because your 2 minutes are over. Thank you.
Okay.
But I know I respect the gray hair, sir. But let's get to this question because it will still speak to what you need to tell me.
Fine, no problem.
Yes. So your baseline findings reveal that women spent nearly 3 hours daily on childcare, compared to only 30 minutes for men. Considering this, how does your intervention aim to relieve women's care burden, and what broader implications might be there for women's economic empowerment? I'll give you 3 minutes for respect.
For that one, okay. What we have done is a very simple process, but also very complex. Because after we did a design, and it's a long story about the design, we chose that if we gave an intervention on caring, school-based care for the children, and we choose one age group of children 3 years old, so we designed to take the 3-year-old children to school. But of course, the obstacle was that we don't have extra facilities in school to support 3 years old, and then another obstacle was that the policy does not require that, the policy of the Ministry of Education, so we had to go through the route of policy to develop a policy in the county to allow the county to take 3 years old to school, and we had to engage the Ministry of Education and other stakeholders to be able to do that. So we were allowed to take the 3 years old children to class as a test process. 1,500 children. There's a category that is in the control, and there's a category that is in the treatment. And in the treatment, we are doing a very simple process where we have an intervention that allows a curriculum that supports 3 years old and also supports the 4 years old, because we chose to put the 2 groups in the same class. And then we had to recruit a teacher and train the teacher together with the other teacher. So we trained them for about 3 weeks of training on how to actually take care of children. And these teachers, after they have been trained, they have another set of mentors, coaches we call them, who go to visit them every day in 1 week to go and coach them or to observe what they are doing and correct whatever mistakes they are making, so that they build their capacity to really focus on the child. And then we also developed a lot of materials. We have a booth out here, and you have listened to my colleagues also speaking. You can go to the booth and see the materials that we developed using local materials to allow the children to have the free play with the materials. And it takes me straight to what Eunice was not able to capture, that this is actually the process of learning in class that allows children to have self-confidence, to really enjoy learning, to really have this process of relating with others very easily and so on. So the issue of removing anger from them and so on is something that we did away with. So just through the classroom process. So this intervention of taking the children away to class, we assumed, or we know, that it has relieved the mothers of time for taking care of this particular 3-year-old child to allow the mother now to do anything else he wants to do. Actually, we have not told them what to do, and we have observed in the midline, and we have seen that actually the mothers have improved on the time they are spending in the market, the time they are spending in the farm, and also increase their time to engage with the child physically. And therefore, even the father's time there has increased in terms of engaging with the child.
Thank you very much. I think that's very great, and we appreciate that. And I want to come back to Lynette. I know we have an online presenter, and I don't know if he's able to speak right now before I go to Lynette. Ambrose, is he able to? The media team. And so as they get Ambrose for us, I know I had not introduced him earlier. I wasn't sure he was online. He is a dedicated community development practitioner with a strong background in public health. He has a Bachelor's of Science in Public Health from Jomo Kenyatta University and specializes in participatory methodologies, serving as a trainer of trainers, skilled facilitator in community engagement communication and risk communication in water, or rather basically WASH programs. He focuses on empowering communities through inclusive dialogue, but also behavior change and sustainable solutions. He is committed to fostering collaboration and building local capacity for long-lasting impact. Is Ambrose there? Yes. So Ambrose, you can hear me? And if you can hear, you can say yes.
Yes, I can hear you.
All right, thank you. So Ambrose, maybe in 2 minutes, could you just give us like a brief summary of your study before I give you my very first question? Ambrose, 2 minutes only. And maybe
Yes.
just to give us the title of Ambrose's work. Sorry, I need to read it for us here. Forgive me. So for their work, their topic is Strengthening Nurturing Care Through Responsive Parenting Trends, Outcomes and Lessons from Moments That Matter project in Kenya. So give us a brief summary, Ambrose, in 2 minutes.
Thank you, Dr. This was an endline study for an 18-month cycle project in Nyamira and Vihiga counties, where we are working with the caregivers at the community level to strengthen them in nurturing care. And through this exercise, we had great improvement in terms of results that were realized through the caregivers' involvement, both male caregivers and primary caregivers, and also the developmental outcome milestones that were achieved through the children 0 to 3 years in those areas of focus. Thank you.
Thank you, Ambrose. And so, Ambrose, if you can help us, looking at your work, we see that this model, it's actually very commendable because it empowers grassroots structures which are critical for sustainability. From your findings, we see that there is improvement in parenting practices, especially in Nyamira. But on the other hand, we saw Vihiga lagged behind. Maybe, which of the factors from your findings or from your engagement in this study, which factors do you think contributed to the disparities between the two counties, Nyamira and Vihiga? Thank you.
Thank you, Doc. Two aspects came out strongly. One is the issue of the socioeconomic factors, whereby you find in Nyamira, there were quite more enabled socioeconomically than the Vihiga. So that is a factor that came out, that you find that most issues of poverty came into play insofar as uptake and involvement of caregivers in the nurturing care as activities were concerned. The other aspect was the issue of the gender norms still coming into play, affecting involvement in both the two counties respectively. However, interestingly, you'll find that in Vihiga, male involvement in activities and stimulation appeared to be more in Vihiga compared to Nyamira. The other aspect was the issue of involvement of caregivers in totality that came into play as some of the key factors. Thank you.
Thank you very much. I'll just add the next question before you get away, and don't go away, please, until we finish this panel. So among the 595 caregivers, especially the caregiver child dyads, from your study, what did the quantitative findings reveal of the level of father involvement in each county? From the 595 dyads, what was the quantitative findings revealing about level of father involvement in each county? Ambrose?
Yeah, from the study, Dr. Thank you. We realized that the quantitative data for Nyamira, there were two key aspects that we were able to look at, or rather that came out strongly. One is the issue of there were more male involvement in stimulation activities in Nyamira as compared to Vihiga. There were also issues of the issue of positive parenting by positive discipline by the male in Nyamira also was higher compared to that in Vihiga. There was also the issue while comparing male caregiver activities in terms of stimulation. You find that Vihiga had higher quantitative responses compared to that of Nyamira.
Okay, thank you very much. And I'll still come back to you, time allowing us. But I want to come back to Lynette as we continue in this conversation. And so you just helped us to see in terms of the burden of the women. But Lynette, if you can help us from the study, do you have any follow-up plans to focus on men's or fathers' involvement, especially in the caregiving, so that it can enhance positive outcomes for children? Just in 1 minute.
Yes, we definitely do. And given that it's a 3-year study and project, we are having some interventions that we're looking to incorporate. And so one of it is having a human-centered design approach where we're going to involve the community members because we're looking at sustainability, the long-term aspect of it. And so one aspect we're looking at is involving the community leaders and the religious leaders so that they can support us in enhancing or also amplifying the importance of, parental engagement for both men and women, and also having these interventions. We really want to involve the men themselves, the caregivers themselves, because they have a say. They're the ones who are taking care of these children, they're the ones who are involved, and they're the ones who are affected. So one of the interventions that we're looking at is co-designing these interventions with them, and also through the county governments that we are working with, both in Isiolo and Lamu. We want to be able to have policies around unpaid care, and so that we can be able to amplify. And also, we are looking to have a change of attitude and beliefs. Thank you.
Thank you. And I just want to get a follow-up question on that, not necessarily in the follow-up with the men, but from your study, you talked about families that comprising more than 5 members. And maybe just to help us see, was it just the nuclear or is the extended? whichever the case, and especially if it is in strengthening, looking at these large families in quotes, 5 and above, in the context of strengthening childcare systems, were there any negative implications, especially with larger households, or was it just benefit, especially in shared responsibility? Was that something you explored in your study?
Yes, it's definitely something we explored, and given that these communities are either nomadic or pastoralist, so you will expect, they will say it's a family of 5 or 12, they will say we are all brothers and sisters. However, the term they use for brothers and sisters, it's generalized. So we were not able to clearly stipulate that this is like the nuclear, but also because they have, polygamous, they're polygamous in some contexts. And so one thing that we really looked at is, given that they are 5 and above, it does not mean we are going to, remove them from the study. However, we saw it as kind of looking at it in a mindful way while designing these programs. So, yeah.
But I was just asking, did you find it as a negative that there are many, or was it positive that there was shared responsibility?
No, it was positive because now the burden is reduced, kind of. However, we are still in the process of conducting the study and also in the intervention phase. So we will be able to see that at the end line if really it had a negative or a positive impact. But so far, it's positive.
Thank you. Thank you very much. Really appreciate that. And back to you, Mnuve, if we can just find out, I think you mentioned about the campaigns you did and just looking at the engagement across the country through the social media. What considerations have you made or conducted as a follow-up to assess actual outcomes, especially across the genders, the language groups, so that they can adopt the nurturing care practices? Thank you.
Thank you. At the moment, we are in the planning process in collaboration with our main partners, who is UNICEF, who has been with us since we started, almost all the documents, and other partners. We are in the process of establishing the ECD landscape in Kenya. We have been presenting ECD landscape in Kenya, but actually we have never had a study on that. But now we are in the process of having a paper. We do the stock take, and actually by the process has started. Next week we will be developing the tools. So we want to ride on that process of stock take, so that we can have at least questions that can look at the impact of that campaign. In that way, we will be able to incorporate as part of our sample size the counties that we have disseminated, which were 6, and other counties. In that way, we will be able to know what change has occurred, even if it's minimal, and also we'll be able to look to other counties that we've not disseminated to see whether there is any disparity in terms and the impact as compared to each county. So we're in the process. By the end of this year, we will have published the results of ECD landscape, and at the same time, we would have gotten that feedback of what actually impact it has caused the campaign.
Thank you very much. Silas, in 1 minute, if you can just tell us from your study recommendations, what studies can be employed to enhance further involvement? And you gave us just in 1 minute.
Thank you. For strategies, number 1, I think let's define what we mean by men involvement. Let's not just come to meetings and start saying men are not involved, men are not involved. What do you mean by men involvement? What is it? Yeah, because if you look at the room here, there are more men than but what is men involvement? Define that. Number 2, if you want to hear about men, speak to men. Don't speak to women about men, asking them why is your husband not involved. Speak to men directly, and they will tell you why they are not involved. Number 3, if you want to design interventions, and one of the things that we want to do is to synthesize and understand all. Thank you. I think the third one if you want, and we want to do a synthesis to understand the impact of many interventions that are targeting men. One of the third thing that we need to do, Daktari, is to do men-only interventions in childcare. Let's not focus on women intervention and expecting men to come and participate in those interventions. They will not participate. Focus only, men-only interventions, and you will see the results of their involvement. Thank you.
Thank you very much. Makofi kwake. And I'm told our time is far much spent, and Prof, it seems I missed this. And maybe we'll interact with you to hear on that, because we need to bring this panel to a close. But thank you very much. As we move on into our next session, I think let's appreciate this panel for the great job done, and we'll interact with them more. We get to the next session. Thank you.
Hello. Hi. We're coming to the last leg before lunch. So I want to guide you to where you're going. We are having breakaway sessions right now till about 1:30. So breakaway room 1, itakuwa Chui. Chui ni kule juu. Sawa sawa. For what is happening in Chui, for those ones who would want to know, strengthening early childhood development systems, that is the conversation in Chui. The chair for that will be Harrison Kamau. So if that is your group, please head there. Kifaru is breakaway room 2. That is headed by Miss Amina Mwitu. Kifaru, again, is where we came from, that block. The discussions there will be from vulnerable to valuable, sustaining early childhood development initiatives. The conversation is headed by Miss Amina. Breakout room 3, ambayo itakuwa Nyati, again, the other end, Nyati. Nyati inaongelelea from vulnerable to valuable, sustaining early child development initiatives. Conversations are headed by Adan Boya. So if you have papers for breakout room 3, Nyati is on the other side. And then Hapa Swara, which will be headed by the session chair, Linda Olo. The discussions will be around equity, diversity, and inclusivity in the implementation of nurturing care and leveraging digital ecosystem for early childhood development outcomes. That is what will happen here. As you go to your breakaway rooms, I will personally be coming round to give you your meal cards. So kindly, usikose meal card. I'm the one who has them. I will also be there for you. So if we can use about 5 minutes to be able to begin, wale wa Kifaru washaanza, I will appreciate. Asanteni sana. Once again, as you leave the hall, breakaway room 1 ni Chui, breakaway room 2 Kifaru, breakaway room 3 Nyati, and breakaway room 4 ni Swara. Lunch will be at 1:30, so that should guide the time management that we have. Ama naona mumefurahi sana na Swara, mnaweza nipigia makofi tukai pamoja, or tunaweza simama tutembee pole pole. Wale wa Swara, Linda Olo, please come to the front. The rapporteur Rachel McKenna is in the room. Rachel, Miss Linda Olo, if you're here. Yes, she's here. Session chair for the room is here. All the other rooms are on the other block. As you walk up to the reception, take your left and you will be guided. Kifaru is on the ground floor while Chui and Nyati iko upstairs. Time management. For people in this breakaway room, people in this room, we have Rehema, Monica, Pepa Yako, ya nurturing care approach for children with disability. We have Stephen Ikonya, Mario Mare. The Action Foundation should be here in this room. We have a case study from
Okay. Good afternoon. Can you hear me?
Yes.
Okay. Good afternoon, everyone. Welcome to this session. So this is the session on equity, diversity, and inclusion in the implementation of the nurturing care and leveraging digital ecosystems for early childhood development outcomes. I will be your session moderator. My name is Linda Olo, and I will be supported by the rapporteur. Please confirm if you are around. Okay. So in this session, we will be having a panel. The panel will consist of Rehema Achieng. Please confirm if you're around. So as Rehema comes, I'll just read her brief bio. So Rehema is a dedicated child and adolescent advocate with a bachelor's degree in education who currently volunteers at KMET Kenya, attached to the Smart Start Initiative project, which is in Siaya County. She coordinates high-level advocacy for nurturing care and disability inclusivity in ECD programs. Her background in leadership and education fuels her passion for ensuring inclusive early learning for all children. Karibu Rehema. Please give her a round of applause. Our next speaker will be Ochan Zekaria. Are you around? Ochan? Okay. Oh, are you Ochan? Okay. So I will skip Ochan for now. Our speaker, the third speaker, will be Peter Obare. Is Peter around? Okay. So Peter is a journalist by profession. He's a communication officer at KMET Kenya with a bachelor's degree in communication and media technology with information technology. He has great passion for nurturing care for ECD, and for the past 7 years, he has been part of communication and advocacy efforts for child-focused initiatives, helping raise awareness of children's well-being and nurturing care interventions. He plays a key role in the Smart Start Siaya project, first in Siaya County, Kenya, and through notable successes, being scaled across the Lake Region Economic Bloc, overseeing visibility, stakeholder engagement, and the promotion of early childhood development. Please give him a round of applause. Next, we have Professor Catherine Gaki. Are you around, Prof? Okay. Oh, she's online. Okay. So I will read her bio, and I hope we'll be able to connect with her. Professor Catherine Gaki Murungi is an associate professor at the Department of Early Childhood and Special Needs Education at Kenyatta University, Kenya. She is an associate professor of early childhood studies with over 2 decades of experience in teaching, research, mentorship, and educational leadership. She is a distinguished scholar in ECD who has contributed extensively to research in child health and development, inclusive education, teacher, professional development, and the use of technology in early learning. And her scholarly work has been featured in prominent global policy publications, which include the Disease Control Priorities and English for Child Development. She has co-authored numerous empirical studies and is a recognized leader in curriculum innovation. She introduced a pioneering course on artificial intelligence in early childhood education, which is set to be incorporated into the department, offerings upon completion of the review. She continues to champion forward-thinking proposals such as robotics and digital citizenships in ECD. Although these were not approved in the last departmental review cycle, they represent transformative, future-ready approaches whose relevance in today's dynamic educational landscape is increasingly evident. She also has a strong track record of institutional collaboration, including a sustained partnership with Child Fund Kenya. Please give her a round of applause. Next, we have Evelyn Ngare. Evelyn is the Director of Fundraising and Partnerships at the Action Foundation. Is she around, Evelyn? Okay. Yeah, so in this role, she leads the fundraising and partnership strategy for the organization by driving resource mobilization efforts, cultivating transformative partnerships, and securing sustainable funding to scale inclusive programs across Kenya. She is a strong advocate for equity and inclusion and is deeply committed to unlocking opportunities for marginalized communities, especially those with disabilities, through strategic partnerships, innovation, and meaningful engagement. Please give a round of applause. We should also have Pauline Masese. Is Pauline around? Online. Okay. Pauline, I hope you can hear us. I did not get that, but I hope Pauline can hear us. So Pauline is a development professional with expertise in ECD, project coordination, gender advocacy, and youth leadership, and is committed to empowering adolescent young learners and advancing inclusive solutions in Kenyan communities. She serves as the project officer for the Adolescent Girls Movement and county coordinator for Imarisha Msichana project at Forum for African Women Educationists, Kenya chapter, Fawe, Kenya. Her work focuses on advancing young learners and girls' education and leadership opportunities from early childhood through adolescence, and her work in ECD emphasizes natural care, school readiness, and the integration of play-based learning in emergencies and undeserved settings. By challenging harmful social norms, promoting community awareness, and advocating for policy change, she is helping to build more inclusive, equitable communities that safeguard the rights and well-being of children, adolescents, and youth. Please give her a round of applause. Finally, is Steve Ikonya around? So I think that is the panel that we have for this session. If there's anyone else who is left out, please let us know, because we had 2 panels that were merged, and I think some people may feel that they've been left out. But for now, I will give our panelists 2 minutes each to tell us, to give us briefly a brief background of their projects and what the key highlights were in terms of the findings. So I'll start with the online people, then we can go to the virtual participants. Thank you.
Thank you so much. And gratitude to the ECD network for creating a platform where key stakeholders can come and discuss issues affecting children. On a nurturing care framework for children with disability, while we all know that that children, the normal children, require nurturing care, we are aware that children with disability require more intensive strategies to care for them. And we know that brain development is very important between the ages of 0 to 3, the first 1,000 days. And the World Health Organization provided the nurturing care framework to address, as a pathway to address developmental issues and to also unlock, to ensure that children have a conducive environment where they can thrive and survive. The nurturing care framework also gives a stable environment where kids are able to access good nutrition, good health, adequate nutrition, safety and security, opportunities to early learning, and responsive caregiving. And when we talk about children with special needs and disabilities, we are not only talking about those with neurodivergent issues, that is those with autism, cerebral palsy. We are also looking at children who are with incarcerated mothers, those in the prison systems, because we know that the prison environment does not allow these kids to really access care like those at home. And we also look at those in institutionalized care, because the environment, they also face stigma. And when looking now at the nurturing care framework aspect with children with disabilities, good health will allow when the caregivers or the mothers are pregnant, when they go to the, let me wind up, thank you. When they go to the hospitals early, when they access these services early, they can be guided to ensure that they are able to track the developmental milestones of the children. When you talk about adequate nutrition, they can be given specified nutrition intervention, supplements that can handle issues like malnutrition and other nutrition issues. When you talk about opportunities to early learning, when these kids have already, when they are disabled or issues, they can be provided with interventions like play-based therapy and other issues around education. And safety and security is just ensuring that as much as these kids are disabled or have delayed milestones, they're able to be in a safe environment where they're able to thrive and survive. Thank you.
Good afternoon. Sorry, it seems I've donated 1 minute to her. Mine will be a bit brief. So my topic was on data and technology for strengthening evidence and accelerating action in nurturing care interventions. So generally, I was trying to look in a situation where our interventions have to be data-led, so that when we make considerate actions, we have to show evidence, and this will revolve around accurate data, and also which will be harnessed in the use of technology. But generally, as we see on our rural and marginalized areas, there's so many gaps on inclusivity, marginalization, and also some cultural situations that make this data not available. But yet we need this data much to do much planning for these children.
We can hear you. Please confirm if you can hear us.
Yes, I can.
Yeah, so thank you for joining us. And we are just starting our preliminary phase of this discussion, and we want to hear what you have to say. If you have a project that you are implementing or a programmatic work in the context of equity, diversity, and inclusivity in the implementation of the nurturing care framework. So we would want you to give us key highlights of your work and the key outcomes or key results that you found out. Thank you.
Thank you. So as you said, my name is Pauline and I work for FAWE Kenya. And we have been implementing some components of a project where we include, my topic was about leveraging digital outcomes for early childhood development. When we talk about how we are using the digital systems, digital platforms to create content tailored for young learners, so that we can localize content tailored for young learners, improve or rather advocate for teacher building their capacities, and parental engagement and enabling infrastructures that enriches learning through play, exploration, and self-digital navigation. So we found that when to playful ways of learning. So our platform talks about having such content developed like videos, animations to enable the young learners to grasp whatever that they've been taught. Thank you.
Thank you, Pauline. Sorry, I gather that you are in the theme of leveraging digital ecosystems for ECD outcomes, so thank you for that. We will give it to Professor Catherine Gaki, who is also online, under the theme of equity, diversity, and inclusivity in implementation of nurturing care framework. Kindly give us the key highlights of your work, or key highlights, your key thoughts on this theme. And if there's work that you are doing, you could please give us the global results of your work in 2 minutes. Thank you.
Thank you so much. We looked at the conceptual foundations of STEAM. And when I talk about STEAM, I'm referring to science, technology, engineering, arts, and mathematics, in line with education in early childhood. We explored the opportunities and barriers to integrating STEAM education in Kenya's
early learning system. We looked at the curriculum and policy innovations for interdisciplinary, child-centered learning. And lastly, we have a framework that supports the 21st century skills in creativity, in collaboration, and in thinking from early years. As I present this, I hope this audience, someone seated in this audience, can, we hope that we can get someone to support this project that we hope to implement. It's ready. We are only waiting for someone to find us, a well-wisher, so that we can cover the budgets and we start implementation at KU. Details of this are available to any interested party that would want to partner with us in this particular project. And you can side chat me. The details can be found from ECD network, and also you can get my email address from the abstracts that have been shared. So I interacted and attended many webinars hosted by Ms. Kim from South Africa on the importance of STEAM education in ECD, and this sparked an interest in me and the team, and we knew something needed to be done in Kenya. Many Western countries already have effected STEAM education in their early learning. So for us, we want to establish what will work for us in Kenya. And I reviewed literature that is less than 5 years old. So we looked at literatures available from the years 2020 to 2024. We focused on STEAM in early childhood education, like I've said. We looked at policy analysis. We reviewed the CBC 2017. We reviewed the competency-based education. And also we reviewed the CBET, Competency-Based Education and Training Framework for 2018. Then we also looked at the Vision 2030 for Kenya. We looked at Continental Education Strategy for Africa. That is for the year 2016 and closing now in 2025, the first 10 years plan. And currently, we've also looked at the one that is being reviewed now, the work in progress for 2026, 2035, CESA strategy for Africa. Then we also looked at the strategies, though under development based on continental consultations. Lessons we drawn from the case studies in Kenya. We also drew lessons from case studies in Rwanda and also case studies in Singapore. And now the other reflections through insights and curriculum development and teacher training in Kenya. So the tools that we used were thematic synthesis, cross-context analysis of enablers and barriers. Our key findings, we found out that creativity and curiosity is fostered through STEAM, whereby children explore, where they imagine, and also it encourages problem solving among children and critical thinking by inquiry and iteration. We also noted that STEAM education promotes collaboration through group task and peer interaction. We also found out that real-world relevance and inclusion is possible when STEAM curriculum is incorporated in the normal learning curriculum, connecting classroom learning to home and community contexts. We also noted that it supports gender inclusion by challenging other stereotypes through diverse role models. And lastly, but not the least, it aligns with global and national policy goals, that is strategic development goals number 4.2, and Vision 2030, and CESA 2026 to 2035, that is work in progress. What are some of the lessons that we've learned as we reviewed and interacted with workshops and seminars on STEAM education? We are able to confirm that constructivist interdisciplinary approaches are ideal for early years. STEAM access must be inclusive across rural and urban areas, and also lack of assessment reforms limits recognition of creativity and problem solving in early grades. What do we recommend? We recommend that there is need to develop STEAM curriculum, guides, and model lessons aligned with CBC. There is need to train teachers through modular pre- and in-service programs like TPD programs offered in universities, KU included. We recommend investing in low-cost scalable STEAM tools like marker spaces and local manipulatives. We recommend reform assessments to reflect on creativity and innovation that matches the 21st century where we are in right now.
Yeah, summarize.
We
Prof.
recommend establishing a national STEAM task force and also promote partnerships, public and private, to expand access and reach. Thank you very much.
Thank you, Prof.
Over.
Thanks. So finally, we have Evelyn. Thank you for joining us. So maybe you could tell us how equity, diversity, and inclusivity sits within the work that you do at the Action Foundation in very, very brief 2 to 3 minutes. Thank you.
All right, I have 2 to 3 minutes. My name is Evelyn Ngare. I work with the Action Foundation. I'm the Director, Development and Partnerships. And so I had a presentation, but I've been given 2 to 3 minutes. I know. In brief, the Action Foundation has been working in Kenya for over 15 years. And the past 5 years, we realized there's a lot more work we can do when we are working with the government. Yes, we were working with the government, but not really going and opening centers. I know someone is wondering, what does the Action Foundation do? We work with children and young people with disabilities in all spaces, health, education, and all of them, because they're all cross-cutting. There's no time you'll drop the ball for a child with disability. If it's education, you have to support. If it's health, you have to support. So we have centers, currently 4 main centers in Nairobi, therapy centers in the inner cities. We're talking about the Kibera, the Mathare, Dagoretti, and Mukuru. So we have centers where we do where we do therapy work, speech therapy and physical therapy. We know there are 5 therapies that a child with disabilities is given. However, for the sake of this conversation, over the past 5 years, we've started working with the county governments. In fact, county governments, some of them came and saw the work we've done with Nairobi County, and we had a good MOU with Nairobi County government, where we were now training the teachers in Nairobi County to, first of all, be able to identify and assess children in their class who have, for example, low vision. I had that question earlier on, that how can a teacher assess a child who has disability? So just really basically assessing that this child has low vision, hence they can't read. It's not that they cannot read. Another one is, for example, a slow learner, how do we support them? I'm actually not able to support them, or I'm not trained, I don't have the tools to support them, but I can assess and know that this child requires more support than what I can do. So that's what we were doing with Nairobi County, and just training the trainers in the schools to be able to identify that. So Kajiado County also came on board, and we started working with them in partnerships with various partners like the Benjamin Foundation and the Wilder Guns, and among others. So what we are doing there is just training the trainers. I know I have maybe a minute, but training their trainers to also identify that. Identify and assess a child who requires more support, from the teacher, that the teacher cannot offer or the school cannot offer, and really go to the person who can support the EACs, the Action Foundations, Ministry of Health, and people who can actually support. So just going over and beyond the centers that we have, the therapy centers, but going out and supporting the county government for their trainers to be able to know how to support all learners, because we are talking about dignity, we're talking about accessibility, we're talking about leaving nobody behind. Just because a child has a disability, they should not be left out of the education system. So we will have to do all that together, education, health, and all ministries. I'll wrap it up like that.
Thank you.
Yeah.
So I think I'll ask our panelists who are physically present here, just quickly, so that we do another round of discussions, but very briefly. Now, we have talked about disabilities, we have talked about children or persons in arid and semi-arid areas. Now, looking at the policy outlook, the policy lens, how do we ensure that we have diversity, equity, and inclusion in the policy discussions? And secondly, maybe we could just take two questions at a go very briefly. How do we ensure that we leverage digital technology to harness inclusivity in the work that we do? Thanks. So I'll start with you. Yeah, you can just do round.
Okay, so I'll say at the Action Foundation, currently, as you see, we are working with these counties, and we are coming to the FCDC. So what we say is we are seeking collaboration. We are really open-hearted, and we're seeking collaboration to strengthen, number one, the teacher capacity of exactly what I've talked about. Number two, the school leaders. It just doesn't stop with the teacher, because a teacher can report a student probably has eyesight issues, and the school leadership does not, So just the school leadership as well, the parents, the caregivers, to build that teacher capacity and implement the training and all that together with them. So we are seeking that collaboration from all actors. Secondly, advocacy for policy changes that are addressing the data poverty. So in the disability space, when you try and check, there's literally a big data poverty. There's no data. So we are seeking that kind of support as well from our data, we call them duty bearers, but from our government. So we are really seeking that support and so to enhance effectiveness in the decisions we are making, so that we are not just coming up with decisions that are not backed up by data. Last but not least, we are seeking to leverage on what we've already built. So could you step onto our, shoulders, and so that you're shoulder above the rest. You don't have to repeat what we've been through the last 15 years. Leverage on some platforms that we've come up with. For example, digital platforms, I'll talk about the ones that young people are able to use to learn and thrive. So how can we leverage on what we've used technology-wise? Reaching the children with disabilities, training models. How do you use what all these NGOs and all that are able to do? Then last but not least, invest in infrastructure. So how do we invest in infrastructure in the special and integrated schools? I don't know, I'll ask a question in the delegates, who has gone to an integrated school and found that it has good infrastructure. So can we invest? I know there's infrastructure, but you know what I'm talking about. They're a bit left behind. Let's purposely consider them as part of our community and invest in the infrastructure mechanisms, and we'll see all of us thrive. Thanks.
Yes, thank you. Okay, so as I alluded, and as my fellow panelists has alluded, is that we need data to make every child get involved and get a potential development. So generally we realize that to do this, we have to have the inclusivity and have technology that can be culturally sensitive. Yeah. So generally for my first point, I talked about culturally responsive design, where I noted that digital ecosystem should reflect local traditions, languages, and caregiving practices to ensure relevance and acceptance. And also, we also use these systems that are already aligned in the community, where we engage people like the caregivers, community health providers, local leaders, so that as we design these platforms or the technology that we are to use, then they get involved, and so then the content will reflect their local languages and also customs and the values. So also, as we work in the marginalized areas or the underserved, we have to talk about the equitable access of these scenarios. So for example, the tools must be designed for low resource settings with offline capabilities. Like in my village, sometimes there are places you can't get the internet or some connection. So we have to include the offline scenarios for these people, and also include the features. Maybe we tailor-make the digital tools so that we can reach people like in the rural families, the teen mothers, and those who are misplaced because of the floods and any other calamities around. So generally, we can talk about technology as a powerful tool, but then to ensure that no child and caregiver is left out, we'll ensure that there is inclusivity, equity, and cultural sensitivity as well. Thank you.
Thank you so much, both Obare and Evelyn have really given great insights. And just to add on it, I'll say that we will need community integration. For success, we'll need blending of digital tools with the existing structures, because there are certain cultural structures that are happening in the community, in the schools, and to ensure that we have trust, reach, and sustainability of the same, you have to speak their language. As much as we are adopting digitalization, you have to really integrate their aspect in order to speak to their hearts. Thank you.
Thank you. So to our online team, I don't know whether Pauline is still with us, Masese. Pauline?
Yes, I'm here.
Yeah, so we are just winding up the discussion, and we wanted to hear what you have to say in terms of how we can harness digital opportunities to ensure that we do not leave anyone behind. What are your thoughts about that? Thank you.
Okay. So my thoughts on that is, number one, we need to recognize that we are living in a digital era where everything now is moving to that particular point where even young children are adopting, or rather are engaging with each other digitally. So as national and county stakeholders, we need to recognize that digital inclusion is as a right and a foundational component of early learning. Thus, we will, as my colleagues have said, we will be able to invest in infrastructure and proper content to be able to nurture their curiosity, creativity, and critical thinking from a very early age. Number two, what we can do is continue with ongoing monitoring and research and data collection to be able to inform the adjustments in matters of, in terms of policy adjustments, as well as provide evidence-based implementation. I think those are the major things that we can do. Number three, we'll always look for partners. Whenever we have, we strengthen partnerships with other people so that we can be able to have affordable and innovative solutions that can reach even the undeserved, or rather the marginalized areas and communities, so that they can also feel included as the nation takes up, young people take up these digital solutions to be able to nurture their curiosity and creativity. Thank you.
Thank you so much, Masese. And finally, to Professor Catherine Gaki, I hope you're still with us.
Yes, thank you.
Yeah, so you can please tell us how we can harness digital opportunities in STEAM around ECD work. Thank you.
Thank you so much. I remember yesterday during the presentations, we heard that there are children who sit on the floor while in classes. We also heard that there are schools with tablets, but with no power connectivity. And we also heard that in Garissa County, there are children who attend school for 2 days in a week. So allow me to speak into policy integration, even as we talk about embracing STEAM education. There is need to embed digital interventions into county integrated development plans, as well as the national strategies and ICT in education frameworks, and then follow them through to see that they are actually implemented. Two, we need to ensure that there is funding allocation to support digital access in ASO and informal urban areas. And as we become digitized, we need to protect child data and privacy in line with Kenya's Data Protection Act of 2019. Since cultures are also different, we may not have a one size that fits all, but we can establish national guidelines for culturally and developmentally appropriate digital content that is approved by various communities. Ensure representation by including all actors, include marginalized communities, include disability rights group, include ECD experts, include the academia, and the digital policy makers. And lastly, set up multi-sectorial task forces such as ICT, where health sector is included, directors of county education are included, and social protection personnel. Do not leave out the child services, the prison sector, because we have children in prisons, for the incarcerated mothers. We need to also work with First Lady scorecards, and the list is endless. We need everyone on board for the sake of the child. Thank you very much, and it was nice speaking in this particular conference. Asante.
Asante sana. So at this point, I want to close this discussion, and I want to thank you for the opportunity to moderate, and I think we look forward to more interaction. Thank you so much to the panel for your contributions. Thank you. Oh, okay. Okay, so I'm advised that we can take some questions from the audience in the spirit of leaving no one behind. Sorry, I was leaving people behind, and I'm here talking about equity. Apologies.
Yeah, thank you. This is Mr. Boru from Marsabit County. We are learning that there's research conducted on harnessing digital technology to promote ECD learning. So I beg to seek to know what is the balance between the digital learning and the print learning. Do we need to shift holistically to digital learning because we are in 21st century, or we need to balance between the digital technology or digital education and print media learning? Because I believe when a learner is involved in, tactile learning, maybe writing or forming a letter using a pencil, that will or writing notes, that will promote more comprehension, more learning, as opposed to screen. I stand guided. Please, what is the balance between the two domains of learning? Thank you.
Thank you. We can take a second question. Then, Then we can get.
Thank you very much for the presentations. My name is Margaret Makelo. I'm the First Lady, Bungoma County. As I said, I came here to learn and see how I can move forward with this ECD system. Today we have had presentations, and especially those sharing the studies that they have undertaken. And what left me a bit wondering, because I need to be guided, is why are we referring to mothers and fathers as caregivers when we are giving results to the outcome of our studies? Because you can't refer to me as the caregiver of my child. Tell everyone that I'm the mother, I am the father, I'm the guardian, I'm a relative. And remember, we also have house helps whom maybe we don't pay or we pay something. We have children in prison, and we have children's homes. Nobody has talked about those guys. So I think it will be fair if we separated the caregiver results so that we know whom we are targeting depending on where our children are. And the other thing I also wanted to provoke maybe some other studies is, let's look at these children's homes. I'm saying this because one of the years I took Kandui Children's Home to be my Valentine. And I went and set up a toy room for the one, not there you even get a 1 day old. And by the time I was leaving that afternoon, 4 or 5 of the children clung on my leg because they want to go with me. And unfortunately, I was so traumatized, I've never gone back there because I didn't have a solution. But now I have, because there's something I can do if we hold each other's hand. So thank you for the presenters. I've learned a lot. And I believe that in the next ECD network conference, I'll be also presenting my results of what has come out of what I will be doing. Thank you.
Hi. Okay, so I'm advised that we can take those two and then we can have two more. So who will take the first question? We also have our online panelists.
All right, so I'll allude to the two of them a little bit. We cannot do away with tactile. Tactile, there's something around motor skills. So there are several skills a child must learn, but we cannot hide under the sand that the future is digital. It's very, very digital, and we have to equip our children wholesomely. We talk about, being local but thinking global. So when you're thinking about workspace, entrepreneurship, you're thinking about employability. I think 10, 15, 20 years from now, we're talking about AI right now. It's here with us. So let's really get into the space and equip our children. I'll give you one statistic. Only 9.6% of children with disabilities aged between 3 and 17 years were attending school for the work that we were doing. Looking at the ones without disabilities, 90% were attending school, so only 10% were not. So when you're looking at even just putting aside these children with disabilities, they're at home, they're not even getting the tactile, they're not even getting the digital. I mean, what's a future? Let's prepare our children for the digital world, but let's not, assume that they do not need the tactile. They need the human, social skills. All right, First Lady, thank you for your sentiments. I know, but when you talk about us as the Action Foundation, when you talk about the caregiver, we are talking about all the other people that are not the parent, all right? So for example, I stand corrected, but as the Action Foundation, the teacher is a caregiver. In my absence, that teacher literally is taking care of my child. Or even in the ECD centers, the person who's taking care, a nanny is a caregiver. Sister, somebody who's just taking care of the baby. And sometimes we mix the caregiver and the parent just to make the data, more explicit. But I love what you just said, and we'll put that into advisement even in the work that we do. But I hope that is a bit more clear from our end. Maybe he can add.
Thank you. Obare, please.
Okay. So generally, for me, I can say technology is just inevitable at this era. But then we just have to include everyone in it, because as well as we embrace technology, we must be sure of online abuse as well. So there's a way that it must be controlled, and there's a way that we can include all sectors to ensure that this is a continuous improvement, so that wherever there's a hitch, it is done and all the marginalized are reached. So generally, we must just embrace the technology, but does not mean that we leave our previous print ones.
Thank you. So I get it that we must use both approaches when it comes to technology. And I think we need to disaggregate our data better so that we stop generalizing when it comes to who is a caregiver. Other people say primary caregiver, secondary caregiver, but if we are able to disaggregate, then we can be able to know who really takes care of children. Thank you so much, First Lady, for that. 2 more questions, then we wind it up. Yes.
Can I respond?
One here and one here. Yes, please, you can respond briefly.
I wanted to respond to the question on whether we need to go fully digital learning or we can just incorporate digital technologies. And my response to that is that the real balance is pedagogy-led and not technology-led. So let's start with pedagogy. What are the learner needs? What outcomes are we targeting? Then select the technologies. Choose tools that support those outcomes, not the other way around. So for us in Kenya, I cannot say right now, like for early years learning, we are ready to go fully digital learning, but we can have a balanced integration whereby we have blended learning, combining in person and also some digital activities like we are currently doing it at the CBC. And we can also use technology to enhance, but not to replace human interaction like my fellow panelists have indicated. And we can also ensure accessibility, training for teachers, and also assessment for effectiveness using technology. So there are good things that we can borrow and include in our day-to-day school learning activities that can enhance our performance as teachers and even the way the children learn. Thank you.
Thank you, Professor. So, yes, Paul, and one more on this end.
Yeah, thank you. Thank you, our panelists. My name is Paul Otwate. I work with African Population and Health Research Center. I'm curious, what I wanted to ask has been already responded by Prof. But the second thing, I'm very curious to understand if there is any framework that we are actually anchoring this particular intervention on use of digital ecosystems. Then the last one is about, you have mentioned about leaving no one behind. What are the plans about supporting we are really focusing on the child with disability. What about the parent of this particular child? What are the plans that we have, especially on the support needs? And most importantly, where we are currently, we have a lot of climate impacts, children that are affected by climate changes. What are we doing in terms of bringing technology to become one of the intervention for this? Thank you.
Thank you, Paul. I hope you took. Okay, one more.
Thank you. I'm Mahfoud Abdullahi, Chief Officer ICT and E-Governance. I'd like to pass my question to the panelists and the only panelist, and it's on the issue of AI. What's the place of early childhood in AI? Because we've moved from the digital age into the AI age. There's a lot of things you can leverage on AI, especially on issues of personalized learning and specialized needs. And I think we've not moved. And what are the ethical implications we should look at as we're moving to that? Because as the world is moving, we'll always get ourselves there. A good example is, I'd also like to mention, is statistics in one of the subscribers' YouTube channel. It's Cocomelon. It's one of the early learning. In as much as we know, but most parents use it. Currently, as at 2025, the subscribership in Cocomelon stands at 195 million. That's a huge number. That's where learning starts, at home. What are the effects to the kids? Because you find that parents turn it on and leave it to the kids. What studies have been done against that?
Thank you. Okay, finally, last of last.
Yeah. Thank you very much. And it's always very good to hear all the good research that is being done in special needs education. My question is to the Action Foundation, Eva. You talked about capacity building of trainers, the TOTs, which is very, very significant when it comes to making sure that they deliver. Because then the issue of capacity is what is lacking in many of our institutions where our learners with special needs are. So my question is, how do you determine the content that is included in that capacity building initiatives that you have? Because there's so much that can be taught from A to Z. So how do you narrow down to say that this is the content that is relevant for the context that you find yourselves? But most importantly, how do you measure the impact of that training to make sure that you're achieving what you intended to achieve? Because it's one thing to train, another thing to determine that the outcomes of that training are really being realized in those contexts where we are. So what determines the content and then the impact. Thank you so much.
Thank you. So our online team, I hope you are with us. So we can split the questions so that you can take some, and then we can give Professor and Masese to take some. Okay, so yeah.
Thank you so much, Otweche. I hope I got the name right. I would like to respond on the plans and support for caregivers. We know that the burden of having a kid with special needs and disability lies with the mother, because first the stigma begins with your partner. Imagine umeshika mimba, umebeba miezi 9, umezaa mtoto ambaye ako na disability. Yesterday we had conversations around disability, and we had one of the speakers saying that wanaume wanaanzia hapo. Unaanza kuambiwa hiyo ni laana ya kwenu. See, that happens. Up from the partner, it goes to the society, because there's a way the society has made a system of how things should happen. Inafaa mtu anashika mimba anazaa mtoto mwenye yuko sawa. So the burden is there, and we really encourage and really champion for caregiver support. We need to strengthen structures that really take care of the psychosocial support of mothers and caregivers. Yeah, thank you. I'll allow Evelyn answer.
All right. I'll also speak to that in the afternoon at 2:55, but I don't know if the times will still be the same. I have another presentation around an elaborate care model that we've been working with our caregivers. So, of course, as she said, they face a lot of stress. They face a lot of stigma from home and from externally, and isolation. You're on your own, in your own world. Day and night, they have no rest. So I'll talk a lot more about the care model that we're working to support them. First, as a caregiver, there are many studies that say if there's positive parenting, then there's stimulation in terms of how the child grows, even if they have disabilities, and how, the results will be as time goes by. Because some disabilities can actually be, supported, and for example, speech therapy and some physical. So it depends with how the caregiver is. So I'll talk more about that in the afternoon. About I know we all love pedagogy, yeah? But on that, I want to say that we are not working in a silo, so we are working a lot with the ministry. We are working with the ministry. We are part of so many, okay, let me not say so many, but we are part of communities of practices. We are part of, we are working with DSNE, and we, whatever content that we're sharing, even if it's from global spaces, we work with the government that is, to customize to the levels that our country or our local context is. I'll give an example. For digital, we're using, I don't know if it's a tool, technology called Scratch. Scratch is a visual fun kind of technology to support learners with disabilities, or just young learners, children and beginners, the ones who are very young, early stage, to have fun and be exposed to STEM-related and digital-related courses. So even with that, we still work with the ministry to see how do we then integrate that in our schools, especially like what we've done in Kajiado and in Nairobi County. So we really work in collaboration, yeah, and have them approve it before we start sharing with our trainers.
Yeah, so I think we also had a question on caregivers with disabilities. I'm not sure if we've captured that. We have, eh? I thought we were talking of children with disabilities. Okay. And then on AI, the place of AI, I think that captures that. And M&E mechanisms, I think that was also raised. If you have any, or you're working on that, or maybe it's a lesson that we can take forward. Yeah.
Can I contribute?
Yes, please, Prof. Briefly.
Thank you. There was a question that was raised by Otiato on why we are focusing on children. Are we leaving the teachers and everyone else behind? Someone else was asking about climate change and how it's affecting early childhood. We have a paper on that. I think it's supposed to be later in the day. And also we have a paper on AI, so those that were interested, please come in and learn what we will be presenting, the findings from our studies. But then we are not leaving anyone behind where digital learning is concerned. And we are not only focusing on the child, we are focusing on the teachers, we are focusing on the child. And also in CPC, when children go home with homework, they go to parents and they go to caregivers who also assist them. So I want to respond to this with an analogy or a metaphor by saying digital learning is the journey. Learning technologies are the vehicle. The balance is ensuring the vehicle supports at the right path that we want to take. with the children, with the teachers, with the parents, with caregivers, and that it doesn't exclude the travelers who will be along the way, the community, the researchers and everyone else, all the sectors that are connected to the child, and is able to adapt to the terrain. And I think that would be my punching line. Thank you so much.
Thank you. Please keep
I'd also like to add something on the AI.
Yes, Pauline.
There's one speaker who talked about how we expose our children to cocomelon and the likes of it. So, AI has negative effects. We all know that. We can expose our children to trafficking, exploitation. We are reducing human interaction. There's no that crucial emotional and social development when we're exposing our children to AI-related content. There are harmful stereotypes. There's digital inequity because a child who is in a rural setup or a low-income setup may be left out from not accessing AI platforms. But then what can we do? Number one, we need to realize that when we're using AI, we're using it as a tool, not a replacement for human teaching. So that's one key thing that as young parents, we need to realize that AI or content related to, increasing, nurturing curiosity and creativity and critical thinking in children should not be a replacement for human learning. It should just be a tool to be able to increase a young child or a young learner's brain development. So we promote blending learning. Number two, we invest in children designing and reviewing the tools that are meant for them.
Yes,
Pauline,
please summarize. We are out of time.
Yes.
Yeah.
Sorry, the same way we are encouraging young people to always be at the table to create their own policies, the same way that we need to ensure that children should also be at the table to look at what is best for them so that they can be able to guide us to be able to create and develop things that are worthful for them. Thank you.
Thank you so much. I think that wraps it up. We are out of time, but apologies, it was worth it. So thank you, our panelists.
We have parting shots.
Yes.
We have parting shots. Just to summarize.
Yeah, we are really out of time, so half a second.
Half a second. I would say that supporting children with disabilities and mental health of caregivers is sides of the same coin. We cannot achieve one without the other. Thank you.
Thank you.
So for me, on technology, I can say that we can introduce digital programs to everyone, and this means a multisectoral approach. And this is why KEMET is coming in to involve everyone, and also the county, to have this as a county-led program so that this becomes a sustainable program in any time ever. Thank you.
Finally,
I just said this in the other panel, but the future is very digital. Let's embrace it, but be very careful. The safeguarding measures, let's be there. And let's not leave behind the children with disabilities and assume that they do not know how to use technology, yet we have not exposed them to technology. But the future is very digital, employability and the rest. So let's be part of it, raise our children to be very globally competitive. Thank you.
Thank you so much. Okay, a round of applause to us as we walk out. I think we can go for lunch. Thank you so much. And the online team. Okay. Yes? Okay.
We can do. San Felix.
I didn't hear you.
What big picture?